Hey everybody, thank you for joining me for episode 4 of The Green Life. I cannot believe it, already number 4. Today's guest is someone that does not really need an introduction. He is an amazing doctor, an amazing spokesperson for animal rights, and an amazing researcher into diabetes, hormonal balance, and the way that a plant-based diet can really help us reverse even type 2 diabetes. He is the president of PCRM, the Physician Committee for Responsible Medicine. He's also a faculty member at George Washington University School of Medicine. He's an author with over 15 books, most of which are the New York Times bestsellers. And he is an amazing speaker. He's also one of the nicest people. He makes time, he's dedicated, he's committed, and is a joy to speak to. Welcome, Dr. Barnard. Hello, Dr. Barnard. Thank you so much for joining me today. It's such a pleasure to have you here on The Green Life. How are you?
Well, I'm doing great, Chantal. How are you?
I'm good. Thank you. Very excited to have you here.
Great to be with you.
So I'm a fan, as you know, and you truly changed my life because of you, I actually went plant-based. I was not very open-minded before. I'm really shameful to say. I thought, I learned nutrition very classic way. So for me, I didn't understand how plants could have everything a person would need and have everything that we basically could thrive on. And when I listened to your talk at IIN about diabetes, that was a really a mic drop, because I never suspected ever that carbohydrates actually could help with diseases such as diabetes. And I was pre-diabetic. I always thought it was, sugar that was the problem. So that was amazing, and it changed everything for me. Likewise, going plant-based helped me with my hormonal imbalance. And so today we're going to talk about hormones for 2 reasons. One is that a lot of my audience are women in my age group, which is late 30s to 50. And your last book, which I have here, Your Body in Balance, is amazing, because you also said you were surprised by the findings. So we're going to talk about a little bit about how a plant-based diet can really help women regulate their hormones. And we can just talk about a few things. We can talk about fertility. We can talk about PCOS, which is a big one for my clients, for a lot of my clients, endometriosis. So I'll give you the space to really, talk about this book and how you came to even look into hormones.
Oh, well, first of all, thank you for covering this, because, I guess I don't need to say to you or to your viewers, because they know this better than I do, that these problems are really common. And the solutions are not necessarily so good. When people see a doctor, they sometimes end up on pills with side effects, but that don't really get to the issue, or sometimes the treatments are even worse than the condition. So anyway, thank you, Chantal, for letting me speak about these things today. Where should we start?
We can start with fertility, because a lot of people I know are in their mid-30s and they're trying to have children, and more are struggling, which is surprising, right? We expect people in their early 30s, mid-30s to be ready to go, but it's not really always the case. So maybe we can talk about that and what your findings are with fertility.
Sure. If you don't mind, let me start with a bit of an anecdote that got me into this in the very first place. We had been doing diabetes research. And, diabetes is a hormonal condition too, but it's a different hormone. The hormone is insulin. It's not estrogen, it's not testosterone, but it's insulin. And insulin is a hormone that gets into trouble too. So we had found that a plant-based diet could have dramatic effects on diabetes. Fine. And we had been studying this. So I'm sitting at my desk and my phone rang. And it was a young woman named Robin who said, I'm in trouble. I can't move. I can't get out of bed. And I asked her to tell me what was wrong. And she had menstrual pain, which many women have. But in her case, it was almost disabling, which is the case for maybe as many as 1 in 10 women have pain so bad that for maybe 1 day a month, they just can't function. She said, I've got a business trip. I have to get on a plane, but I can barely move. What can I do? So I I said, well, I can give you some powerful painkillers to get you functioning now. But then I thought, well, what's going to stop this from happening next month? And the month after that. So I asked her if she would do an experiment with me. And I said, how about if we avoid animal products completely for the next month and also keep oily foods really low? So things like vegetable oils and peanut butter, and keep them really, really low. She said, I'll try anything. And she called me back a month later. She said, I got to my meeting. Thank you. but more importantly, she said her period stopped. I mean, her period started a day or so before she called me. And she said, it's amazing. I didn't have any symptoms at all. Just an absolutely normal period, no pain. And then the month after that, and the month after that, she was just fine. And so I thought, well, that's good, but we need to really test this. And so I brought in a large group of women. They all had moderate to severe pain. And we tested the diet and it worked great. And I should confess the reason that I suggested this. I don't think any doctor ever suggested anything like that to a patient before. And it was strictly an educated guess, because cancer researchers had been looking for a long time, how can we reduce the amount of estrogen in the blood so that it doesn't promote breast cancer? Because we knew if you take blood samples from women, if you got too much estrogen activity, it can increase the risk of cancer. Estrogen preparations will increase the risk of cancer. So the question was, can diet affect this? And researchers at Tufts University found that you can reduce the amount of estrogen just by greatly increasing fiber, reducing fat. And so what did I do with this young woman? I gave her a diet that did those things to see what would happen. But I pushed it kind of to the extreme with her, and it worked great. So anyway, so what you asked me about fertility, and I'm coming to that. In the course of this study, which we published now, 20 years ago, there was one of our participants. And she said, I was talking to all the participants about birth control. They said, in this study, it's a hormone study. We're looking at how foods affect hormones. So if you are taking hormones, including birth control, it's going to confuse our study. So please, if you're sexually active, use a different kind of contraception. And one of the women said, I don't need any contraception. She said, I'm infertile. Oh, wow. My husband and I were both evaluated, and it's not him, it's me. I just don't ovulate, nothing happens, da, 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 da. So anyway, I think it was the second month that she was on the plant-based diet as part of the research study. She came in and she said, Dr. Barnard, I've got some news for you. I said, what is the news? And she says, I'm pregnant. And she said, I'm sorry I have to drop out of your study. But anyway, she wasn't using any birth control at all. She wasn't using the pill or anything because she thought she was infertile. And lo and behold, once she got on the diet change, she got pregnant. Well, why? Okay, so you asked this great question. For a lot of women, this is a big issue. If our hormones are just going what I call haywire, too high, too low, all over the place, ovulation, and then, which is where you release an egg, and then the implantation process, these are delicate processes. They go wrong all the time, even if you're doing everything right. So a plant-based diet is a really great way to get your hormones in balance. Number two, when the male partner goes vegan as well, this may be a surprise to guys, it helps their fertility too. Researchers went into infertility clinics. They tested men, and what they found is the more cheese the men ate, the lower their sperm counts, the worse their sperm motility. Motility and morphology, those are the movement and the shape. Cheese? Why cheese? Well, an obvious reason. Cheese comes from a cow. Cows are pregnant during much of their milking period because they're inseminated every year. And there's estrogen in all dairy, especially in cheese. And so here you've got some guy who wants to conceive. He's feeling very masculine, but he's eating estrogen every time he has a glass of milk or a cup of yogurt or some cheese. So a plant-based diet, there's a lot more to fertility than this. But just getting the animal products out and replacing them with foods that are low in fat and high in fiber, that's really job one for fertility.
That's wonderful. I'm so happy that the lady found out that she actually could conceive. And it's interesting how doctors probably look at hormone balances, hormone levels, and then decide, okay, actually, no, you are infertile. But that's not always the case. As it could be changed, it could be adapted. So a lot of women should probably look into lifestyle before giving up, as such.
Well, yes, and frankly, before that, I mean, people in the United States, and it's also true elsewhere in the world, people spend tens of thousands of dollars or hundreds of thousands of dollars on evaluations, on assisted conception, and all these kinds of things, and think, wait, just stop. Let's at least just get our body working right. The young woman I was describing, she's a real woman, and she had to drop out of our research study because she was pregnant. But I did run into her several years later. She had 3 children at that
Wow.
point.
Wow.
So the issue was a biochemical one, but we see this everywhere. And for some women, infertility relates to endometriosis.
Yeah. Yeah. Actually, I have a few clients who have that problem too.
It's a miserable condition. And in endometriosis, as you know, the cells that are supposed to be lining the inside of the uterus, the endometrial layer, that kind of cell is now outside the uterus. And it's implanting, and it implants on the ovary. And you can almost think of it as sort of strangling the ovary or the fallopian tubes. And they will implant on the intestinal tract. So it means not just is your reproduction affected, but your digestion is affected. And women will have digestive symptoms, and it goes with your cycle. So when estrogen levels well up, a woman's cycle can be prolonged, lots of bleeding, the pain can be really bad. And so the surgeon says, that the gynecologic surgeon says, don't worry. If the pill, it will put you on birth control pills, and maybe that'll regulate it, but it may not. We can operate. And they make a little incision, they insert a laparoscope, and they sort of kind of indelicately vacuum out those abnormal cells. And a woman feels kind of okay after she recovers.
But that comes back.
Exactly. You haven't stopped what caused it. 8 months later, 10 months later, 12 months later, the symptoms are there. And after a couple of years, she goes back and has surgery again. And the doctor has to say, this isn't curative. We're just cleaning it up, and you have to live with this for the rest of your reproductive time. Stop. We do need more research on endometriosis. However, it is dependent on estrogen. And if estrogen can be influenced by diet strongly, then I recommend 3 things. Number 1, you want to greatly increase the fiber. That means plant foods. If everything that you put in your mouth is from a plant, it's a bean, it's a vegetable, it's a fruit, it's a whole grain, it's all the wonderful foods that those turn into, then everything you eat has fiber. And then you're not eating any animal fat at all. So high fiber, low fat. And to avoid dairy, it's a really good idea. We all grew up with this idea that milk is perfect. Milk is certainly perfectly promoted by the industry. But when we get away from it, we're getting away from estradiol that the cow made and that we have no business consuming. So those steps, we see lots of women who just sort of on faith, they try this diet approach. And then they don't have endometriosis anymore. We don't know yet how many women will benefit from that. But I encourage any woman who's got endometriosis now or who has pain and imagines it might be endometriosis, by all means get medical evaluations, but get on a really healthy diet. And you don't have to wait forever. Jump in, do it now, wait 2 cycles, 2 months, 3 months, 4 months, something like that. You're going to know what it will do, but do it all the way. Don't have chicken on Fridays and fish on Saturday and do it part way, because that way you're never going to know if the treatment works. Let's cure you first.
Yeah, cleanse completely.
Yeah, exactly. If a person has pneumonia and you take an antibiotic, instead of 4 times a day, you take it 1 time a day. You're never going to cure the disease. So let's focus on the short term, knock it out if we can.
Yeah, absolutely agree with that. Actually, I have a testimony of a friend who has actually, I think, had endometriosis, and she wanted another. She had a child before, but wanted another one, and they thought, it would take forever to conceive. But she did go plant-based. Meanwhile, between the first and the second child, and it happened very quickly after that. So she was surprised because she didn't go and see a doctor to fall pregnant, but she was like, "Yeah, I know that it's gonna be hard, but it was much easier than the first time because now she had changed the diet." So that definitely has something. And I know sometimes these are anecdotal, but they contribute to why we can research and look deeper into things, right?
Oh yes, let me jump into that just really quickly. There are lots of anecdotal cases, and that's actually an important part of science because it's an anecdotal observation that gives us a clue for things we can test. Like the young woman named Robin who called me up, that's an anecdotal case, and I was impressed by what we could do. But what that does is it generates a hypothesis. I then do a randomized clinical trial in lots of women to test my hypothesis. And then after I've done that and I know that it works, I can confirm it in further studies. Other researchers do the same. And then we try to nail down why the heck does it work? And so we do mechanistic studies to try to understand. But that's the way science proceeds, and it's been very, very effective.
Yeah, absolutely. Now I have a question. A lot of experts in fertility that do not essentially embrace a plant-based diet, although they do recognize that having a higher intake of fiber is beneficial, but they do also advise to take animal protein, and they definitely push on the need for fats. And obviously, your take is very opposite to that. Now I know that you're not opposed completely to things like almonds and whole fats like from the food, but we definitely with this approach that you have low fat, there are things that we take out, such as peanut butter, for example. Why do you think there is such a contradictory view from people that are experts in this field, and they promote the use of animal products in comparison to you?
Well, first of all, research in many of these areas is still continuing. And so I think people have legitimate differences of opinion, and people are making guesses sometimes. However, there are a couple things. The first is that a natural diet is fruits and grains and vegetables and legumes and that kind of thing. And an olive tree doesn't have a faucet on it where oil comes out. When you get olive oil, you take 10,000 olives and you throw the whole olive pulp and all the fiber away. And you're concentrating that oil in the same way as sugar from sugarcane is. You take the sugar out, you throw all the fiber away, and that's concentrated. But when it becomes oils, we kind of romanticize them a little bit, and we give it a word like virgin. And yet the fact of the matter is it's a concentrated product that nature never had in mind. So it's not a big surprise that it changes our body chemistry a little bit. The other thing about it is that oils do have a lot of calories, and 9 calories in every gram, and that's more than pure sugar, more than double pure sugar, more than in any kind of carbohydrate. And so for some people, weight is getting in their way too. And when we get away from the fatty foods, our weight tends to go toward where it should be. Now, sometimes people say, well, wait a minute, if a woman is really underweight, that's going to goof up her fertility too. And that's true. But her answer is not to be eating guacamole all day long. Her answer is to eat healthy foods and get to the weight that's natural for her. But I have to say, I mentioned earlier that researchers at Tufts University and other researchers too were looking at different parts of the diet and how they affected estrogens. And we know why fiber works. We know why fiber reduces estrogen, because fiber helps to actually eliminate estrogens that are in the digestive tract. Fiber kind of pulls them out. We don't know why fat does this. We just know it does. And the reason I say that is that women in metabolic ward studies, given lower fat diets, their estrogen levels come down in a healthy way. You put them on a high fat diet, their estrogen levels go back up. So we don't know why, or at least I don't know why. I've never seen a good explanation for what's happening. But when somebody says, oh, you need more fat in your foods, you need this, you need that, they're kind of giving their grandma's advice, and it affects your body, and you can just watch their estrogen levels become disordered as a result of that.
Yeah. In fact, in your book, you did mention, which is something I didn't know, but fat cells release estrogen, right, into the
Oh
body.
yeah, they,
And
for women and for men.
how interesting. So yeah, so the adipose fat that is cushioning your belly, that's probably even worse because, well, it's close to your main organs that are supposed to cleanse your body from everything that you don't want in there, like estradiol, extra estrogen, and instead you're actually producing more. So double
Yeah.
whammy in the wrong direction.
Oh yes, and you see this with men. A lot of men. Well, there are men who get some breast enhancement. Um, and some of them have mistakenly thought that that came from soy.
Yes.
You'll hear people say this. They'll say, "Oh, that's." They think that the isoflavones in soy caused that, but you can easily disprove this. Go to any beach on a hot summer day, and you'll see a heavyset guy who does have some breast development as he's pulling off his t-shirt. You can see it. Go right up to him and ask him, how much tofu have you eaten this week? And I guarantee you, he will say, I don't eat that stuff. Are you kidding? I don't have tofu. I don't have that. Well, what do you eat? Well, I eat cheeseburgers. I eat pizza, whatever. The reason that he does have some breast enhancement, but it's not from eating soy. What it came from is he's eating cheese and meat and other fatty foods. And as he gains weight, every one of his fat cells has an enzyme called aromatase, like an aroma that you smell, aromatase. It takes his testosterone, and the aromatase enzyme modifies the testosterone and converts it to estradiol, and it shoots it out into his blood, and it goes to his chest, and he's starting to make not just body fat, but breast tissue. This happens in a woman's body, and that increases her risk for cancer. This is part of the reason why overweight women after menopause have a much higher risk of breast cancer than other women, and why reduction of body weight, hopefully through a low-fat plant-based diet, is a good approach for reducing breast cancer risk. And it's also a good approach for this man who wants to get rid of his man boobs. He should actually be having more soy, because soy does not cause a hormonal problem. It does just the opposite.
If you, that's great, and I completely agree. And I saw your studies, and I saw other studies that confirm this. So I do like soy myself, and I want to stop on soy for a second because I think we can also bring it back to another hormones or the hormones produced into the thyroid. I come across a lot of people that have hypothyroidism, and they avoid soy completely. Though there are studies that show that actually use of soy products can be quite beneficial, even more if they're fermented, like tempeh. Um, but they're just very afraid of using soy. But what are your findings in this area?
Well, first of all, I should say soy is beneficial. Soy reduces breast cancer risk. Soy also reduces mortality in women who've had breast cancer in the past. That's important to emphasize because there are circulating myths that suggest that soy could cause breast cancer or cause it to progress. All the evidence that we have shows precisely the opposite. That said, soy is optional. You don't have to have it if you don't like soy milk. You don't have to have it, but it's got lots of benefit. With regard to the thyroid, there are really a couple of issues. The worldwide, the biggest reason that women and men are running low on thyroid is that they're not getting enough iodine. And that sounds like funny. How, what is iodine anyway? It's just an element. It's an element that's you see it especially in sea vegetables. And if you grew up in Japan, you're surrounded by the ocean. Sea vegetables are part of your diet, and this is true for many countries. But it's not true for North Dakota, which is where I grew up. And so people don't know, what these things are. And so people run low. Many salt products have iodine added just as an easy way to get it. And frankly, that's a good thing for the thyroid. However, modern people tend to have Himalayan salt or sea salt, and it may not be iodized. And if they don't have a taste for sea vegetables and they're not getting iodine in their diet, they'll run low. So that's an easy thing to fix. The second thing, if you look at many, many cases of low thyroid, The problem wasn't that a person was low in iodine, or that wasn't the only problem. The other problem is that their body is making antibodies. Somehow their immune system thinks there's an invader, like a virus or a bacterium, and somehow their body is making antibodies, and those antibodies are looking for a target, and they end up attacking your own thyroid.
Yeah.
And that's actually, in the United States, our biggest problem, and that's true in many other countries too. And doctors can do tests, and they can find those antibodies, and then they say, well, we're not too sure what to do about it. Researchers in California at the Adventist Health Study 2 brought in tens of thousands of people, and they found something stunning, that these conditions follow dietary patterns. In retrospect, this shouldn't have been such a surprise, but they found that the dairy eaters, people who were vigorous lovers of dairy, were at the highest risk for hypothyroidism. People who are on vegan diets were at the lowest risk for hypothyroidism. And for hyperthyroidism, too high thyroid, that's people who ate a lot of dairy and people who ate a lot of meat. And once again, the vegans were at the lowest. So the reason I say this shouldn't have been a surprise, we learned a long time ago that your immune system does its best, but it gets confused. And so let's say you've got some dairy protein coming in, or a chicken protein coming in, or fish protein coming in. Sometimes your immune system thinks, I don't know if that protein came from a fish or from a coronavirus, or I'm not sure what it is. So I want to attack it. So your immune system is kind of inexact. So my point is, animal proteins often trigger immune responses that are inappropriate. We've seen this not just with hypothyroidism, but we also see it with Sjogren's disease, with skin conditions, probably with type 1 diabetes in many cases, with asthma. If you've got a kid with asthma, immediately, do not wait another day. Put that kid on a completely dairy-free, plant-based diet and just see. In so many cases, that child doesn't need so much medicine. That child can run and play again. And we never realized that the problem was that there are foods that are masquerading as invaders and causing immune responses. So we don't have all the information we need on thyroid, but those are the big considerations. With regard to soy does not seem to increase the risk. However, I do have one caveat. Let's say you've got low thyroid. Don't have soy products with your medicine. Have your medicine on an empty, and not just soy, don't have anything. Don't have your medicine on an empty stomach, because your body will not absorb it. Well, there are many medicines you can absorb with food in your stomach. Thyroid hormone is not one of them. Empty stomach, don't have soy before or right after taking your pill.
You say about an hour or half an hour?
Yeah, something like 30 minutes before, but also maybe even a couple hours after.
Okay.
So, but you'll get into a groove. People with who are on medications know how to take them and know when to take them. And it's not just soy; it's anything. So.
Well, I was asking when, because my mother takes some support for her thyroid, and she takes it with breakfast. So I will have to share this with her, because
yeah. No, yeah,
she definitely needs time. So, like, how long before to take it or not?
Yeah, something like a half hour or something like that, and then it's a good idea to wait. But she doesn't have to take her pill in the morning. She can take the pill later on. She could, different times of day.
Okay, brilliant. I'll share that information with her.
Yeah. Oh, yeah. It makes the medicine work much better.
Yeah. So my other thing that comes up a lot, my concern from clients is PCOS. So a lot of clients with polycystic ovaries, it's becoming a bit of a trend, which is not great, like endometriosis. And one of the things, obviously, that I think you're definitely an expert about this, and you might give us some information on, is the tendency for women with PCOS that they have about having high insulin levels. So they tend to easily become more sensitive to insulin, and therefore can have the risk of having type 2 diabetes. So I guess the protocol would be the same, plant-based diet, low fat. And maybe we can just segue into why low fat is so important for diabetes, because this is something I learned from you, but a lot of people still don't understand that carbs are not the problem, the fats are. So maybe you can just shed a bit of light there.
Yes. Thank you for asking about that, because this is important, not just for polycystic ovaries, but also for type 2 diabetes, and frankly, even for type 1 to a degree. It's a bit of a different disease, but insulin resistance is what we're talking about. And it plays a role in all of these conditions to a different degree. But what's happening when a person has, say, type 2 diabetes? They go to the doctor. The doctor draws a blood sample, and their blood sugar is elevated. And they also notice that if they have a sugary food, their blood sugar goes pretty high and it stays high. And so it's completely understandable that they would imagine that sugar is the problem, or bread or potatoes, other starchy foods that release sugars in digestion. That's got to be the problem. So they avoid those. The doctor doesn't know better. So I'm sorry to say, doctors don't study nutrition very much. So the doctor says, yeah, don't eat too much carbohydrate, don't eat too much sugar. And as long as they do that, their blood sugar never goes too high. That was not the problem. The problem was their insulin isn't working right. Their pancreas, which is right behind your navel, behind your belly button in your abdomen, it makes insulin. And insulin goes through the blood to the surface of a muscle cell or the surface of a liver cell. And it acts just like a key. That insulin opens up the membrane to let the sugar inside. And if you have type 2 diabetes, your insulin is there, but it's not working well. The key is really having trouble opening it up. And so the sugar is building up because it can't get into the cell. And for most researchers, they never went past that. But our team said, and other teams too, like Jerry Schulman's team at Yale, said, why is insulin not working? And using a technique called magnetic resonance spectroscopy, which is very expensive, you can look inside the cell. We have done this. What we find is that microscopic fat particles stop insulin from working. Where did they come from? They came from your ham sandwich. They came from a steak. They came from fatty fish. They came from any kind of fatty food. The fat from the food builds up inside the cell, and now the insulin can't work anymore. The insulin shuts down, and now any sugar that you eat just builds up in the blood. You could stop eating sugar, but you're not tackling the disease process. Stop. Get the animal products out of your diet. That eliminates 100% of animal fat. Keep oils low, including almonds, including olive oil, all of it, because I want to cure your diabetes if I can. So we're going to keep the oils really low. There are some natural traces of oils even in beans and vegetables and things, but it's going to be really low. And what happens is that the fat starts disappearing from the cells. The sugar can now get in because insulin can work, and you discover I can eat carbohydrates. And I can eat the natural sugars in an apple, and my body's back to functioning the way it should be. Okay, so I don't have type 2 diabetes, I got PCOS. In PCOS, we see that same insulin resistance. Mm-hmm. This aggravates problems with there is a genetic component to PCOS that's significant, where the body's making a little bit more testosterone than Mother Nature was hoping would happen. And this insulin resistance drives that too. And so women will discover some thinning of the hair, maybe a little bit of facial hair, and that's the testosterone welling up. So we're going to use the same kind of diet that we'd use for type 2 diabetes for PCOS. Now, it doesn't mean the disease is completely gone. What it does, it means we're counteracting it in the best possible way.
Brilliant, brilliant. I mean, I must say, while we were talking about hair, I was like, yes, I've noticed my chin sometimes as a stray hair. Is that I'm getting old, my estrogen is going low, my testosterone is too high. What's going on? Sometimes I have to check in with myself. It's very interesting to see how the body works, because everything has to be in balance, but it's so hard. So let's actually segue into disruptors, right? Because one thing is, okay, we nailed the diet. We are on a plant food diet. We are keeping it clean, low fat, but we're still affected. And there are disruptors. What are the ones that are most common that women find attack, their balance, and they don't really think about, but they could be really anywhere, right? What have you found? Yeah,
there can be, but I have to say, there are lots of folks who focus on chemicals in a plastic bottle and things like that, and those are there, and I think it makes good sense to avoid them. However, I am convinced that the dietary aspects are much more decisive than chemicals that we might get in the environment simply on a gram per gram basis. You're taking something in a large quantity and swallowing it, as opposed to tiny traces in water and food and that kind
I mean, I
of.
guess, sorry.
Yeah, no, please.
I was just thinking, I guess if you think about fish alone, right? The amount of plastic that is in the oceans, and then you eat the fish, you eating the fish and the plastic. So you have like more and more and more and accumulates. And so even that, right? Even from the diet, you get these disruptors.
For two things. One is fish, the other is dairy. And the reason is that those are the top of the food chain. And I know that sounds funny to say, but the little fish is eaten by the bigger fish, who's eaten by the bigger fish. And finally you get a tuna or something that's eaten all these. And the chemicals will concentrate, and not just plastics, but things like PCBs and others will concentrate. They will bioconcentrate, particularly into the animal's fat. And so a person chooses the fatty fish for the omega-3, and they end up getting a boatload of contaminants. Now, dairy comes out of a cow, and the cow is vegan. But unfortunately, what happens is the cow has been, or any other animal, but the cow is eating grass or grains that they could be chemically treated non-GMO or GMO products. Who knows what's in them? The cow's body concentrates chemicals and they end up in the milk. So Mother Nature never thought that a human would drink the milk of a cow, or that cows would eat the things that they're eating now. Yeah. So getting away from dairy and getting away from fish, those are two really good ways to avoid chemical exposures.
Okay, brilliant. What about actually, you mentioned for the omega-3 fatty acids. What about people that feel they should supplement things like DHA and EPA? Because some of us are not very good at converting ALAs into DHAs. So I read a study. There's a study that talks about how people that grew up ancestrally on a more plant-based diet have a better capability of doing this conversion versus countries that relied on eating fish and didn't have to really convert anything. And that was an interesting one to read. But now when we are going, so obviously the assumption is like, I'm not going to go back and look at my genealogy and see what my body can and cannot do according to what my ancestors were eating. But so a lot of vegans are taking EPAs or DHA rather, that is vegan from algae, so better than having the fish. But I've seen research from different kind of doctors, and I had Dr. Furman on that talked about how he supports taking DHA because he sees that a lot of people easily get deficient. But then there are research that talks about against taking any supplements, and that even some supplements can cause things like cancer. And I think the DHA were one of them. What did you find, and what are your thoughts about it?
Well, first of all, I should maybe preface my remarks by saying that supplements play a role in general, and the one supplement that is really important is vitamin B12, and people should be making sure they've got B12. If it's not in fortified foods, they should take it as a pill. The reason I say that is I'm going to raise some cautions about DHA supplements, and I don't want people to think that applies to everything being bad. Your body, just as you were saying, Chantal, your body makes DHA. Your body will take ALA, alpha linolenic acid, and which is plentiful in plants. And your body will take that, and you have enzymes that will lengthen this little carbon chain, and they make EPA and then DHA out of it, and the DHA works great. But for some people, that process is slow. For everybody, it is made slow by eating other competing fats, because the enzymes can handle only so much incoming mail, and if they're getting all kinds of other fats, they don't get the ALA, they don't deal with it. So the answer is make sure you got a lot of plants in your diet, especially green vegetables. I know that sounds funny to say, but they have a lot of the ALA in them, at least as a proportion of their fat, which is what seems to really matter. Is there a lot of fat, but what proportion of it is ALA? And green vegetables are surprisingly high. Avoid the other fats. Don't have a lot of fried stuff, because that's going to get in the way. And then should you take supplements? I don't think we really know. The argument for them is that people whose blood tests show that they're low in DHA, some have suggested that there might be a higher risk of dementia later in life for those people. So they're busily supplementing. Other studies have said, and this is a caution for men, that men with high levels of DHA have higher risks of prostate cancer. And that appears to be true. At first, we thought this was just a fluke, but there have been so many studies that have been showing that a whole lot of men are saying, wait a minute, I'm not so sure that I really want to be taking DHA and EPA. So the short answer is we don't really know. But one way that some people resolve it is they get tested. It's a pretty easy thing. There are lots of companies that'll send you a little card and you put a dot of blood on there and you mail it back and they'll tell you what's your EPA and DHA levels. And if you're low, if you wish to supplement, you can. And then 6 months later, you test again. So that's one way that people are negotiating this. But I don't think we are as smart today as we're going to be in 5 or 10 years.
Yeah, of course. We are advancing. I mean, everything is changing. Yeah. Even just the last 2 years have taught us so much about our immune system and actually how, even you mentioned at the beginning, our immune system does the best it can to defend us. It's not perfect, but the way that we feed our body can definitely help it do its best job. And we've seen it with the pandemic, right? People that feed themselves a healthy plant-based diet have, I got the virus and but I recovered very easily. It took me 3 weeks, but I recovered without even needing medication. And I really bring it down to the fact that my body has been really blessed with all the nutrients that I've been taking and from the food that I've been eating and not having anything that made my immune system incapable. And so even in the last 2 years, I think we've seen such a big shift. I wish we had more focus on promoting the foods that are good for us because the government doesn't do a very good job at telling people, to eat better. Most of the time, that's not a message I've seen a lot. I don't know if you have. If you have, you're lucky. I just don't understand how we don't. But one of the things that I found in the research about immunity and I guess we can talk about vitamin D very quickly. And I know you said B12 is something we should supplement as vegans, and I guess vitamin D, because that's actually a hormone as well, right? So how do you feel about supplementing vitamin D, considering that it's been linked so closely to our immune system? And in the last 2 years, we've seen such a big importance of that to make sure our immune system works.
Well, our species began in Eastern Africa, and sunlight was abundant. And our body took advantage of that sunlight. The UVB rays that hit your skin produce vitamin D. You don't need a pill. You don't need a pharmacy. Your body makes vitamin D. But some of our forebears had the bad judgment to leave that wonderful environment and to go to cold places like Fargo, North Dakota, which is where I grew up. And I can tell you, in around February, you're not getting any sunlight on your skin at all. And if you use a sunscreen in August, you don't get the UVB rays then either. And so people can't depend on sunlight. And so if you're getting regular sunlight on your face and arms, you don't really need a vitamin D supplement, probably. But if you're not in that category, then you do want to supplement. And so I would recommend that in general, it's a good idea to supplement. And this is true regardless of what your diet is. And about 2,000 international units of vitamin D per day makes sense.
Brilliant. Thank you. Okay, so I guess now if one of our listeners is okay, I have all these little issues that I have to fix, either it's PCOS, either it's endometriosis, or they're struggling to conceive. Let's give them an example of a day diet, like what they should eat in a day, according to Dr. Barnard.
Well, you can eat really whatever you really choose to eat. And what we often do in our medical center that we have here is we sit down and look at what are you eating now? So in the United States, it might be a little bit different from somewhere else, but an American might have, say, a bowl of oatmeal, but they'll top it with cream, or they'll have cornflakes and they'll top it with milk. You say, well, instead of the cream, why don't we use almond milk or soy milk or something like that? And fair enough. If a person was maybe in France, they might have a piece of bread which they'll slather with lots of butter. Well, the bread might be okay, but maybe the butter is not. So we make changes there. Where I grew up, everyone loved sausage and bacon, this big heavy breakfast. Well, there's veggie sausage now, if that's what you want, fair enough. But I think people should experiment and see what they like. When I was a child, I never, ever tasted scrambled tofu. But it turns out that tofu is exactly like egg white.
Yeah.
I mean, it's just the same. And one is from a plant, the other is from an animal. So you take and you scramble the tofu with vegetables and flavorings, and it's a thing that people are afraid of until they've had it made the right way, and then they get addicted to it. So find what you like. When you're planning your meals, it's good to think international. So here in Washington, D.C., where I am, if I go out of my office, there's an Italian restaurant where I can get angel hair pasta topped with an arrabbiata sauce or a marinara sauce, which is completely plant-based. They didn't advertise it that way, but it is. And it has vegetables on the side and a minestrone bowl up front. And right next to it is a Chinese restaurant with rice dishes and vegetable dishes and tofu dishes. And across the street, there's an Indian restaurant with treasures made from spinach and lentils. So when we think international and we see the other cuisines, we find choices that really work for us. But my rules are, take a short period of time. Don't feel you have to make a decision about what you're going to eat forever and ever, because that feels kind of daunting. Take a couple of months and decide that I'm going to give a test of no animal products at all. But to make this easy, start with 1 week. And during that week, don't take anything out of your diet. Eat whatever you want, but use that week to test out foods. All right, Dr. Barnard said maybe I should try veggie sausage and scrambled tofu. I don't know. I'll try it. Or I never had almond milk. Maybe it's good. I don't know. There's a Mexican restaurant here that has beans. I don't know. I'll see if I like it. Okay, take a week, test it out. Make a list of foods you like. Then do your diet test. Completely vegan now for about 3 weeks. Or if you've got menstrual pain or whatever, give it maybe 2 months. Because you want to go through a couple of cycles and get all the way through from the beginning of one period all the way through that cycle and hopefully 2 or 3 more. And that will really show you. But during that time, when you're doing a test to see how it affects you, no animal products, keep oils very low. Yes, that's important. Don't forget your vitamin B12 and see how the diet works for you. You're going to discover there are 4 groups of foods that come into your diet a lot. One is the vegetables. You're going to see that they have real power and they're not afterthoughts anymore. They come in a big way. The green ones, the orange ones. Whole grains are good. Brown rice, never had that as a child, but it's good. There are a lot of others too. Beans are poor people's food. That's what we thought when I was a kid, because they're really inexpensive. They're very nourishing, high in protein, and great. And fruits, what a great dessert, what a great snack. You can have them anytime. Those 4 groups are going to come in a big way in your diet, and you're going to discover all the joys that can be made from them.
Brilliant. Okay, what about now for women that are past their reproductive years or decide not to really have children anymore, and now we're going towards perimenopausal and menopause? Have you seen, well, in your book, you obviously shared that. What is the biggest impact a plant-based diet can do on a woman going into menopause? Because I think that's a traumatic time for us women when everything is really changing.
Yeah. Different women have very different experiences. Many women sail through menopause with no trouble. That's fine. But for some women, they have hot flashes and other changes that occur to them. Hot flashes is the biggest complaint probably. And what happens is for a minute or 2, your body becomes really hot and you are sweating and you're left drenched in perspiration. And it can happen throughout the day, or it can happen several times at night, and it disrupts sleep and it ruins your quality of life. So we recently completed a research study where we did 3 things. Plant-based diet, no animal products. We kept oils really low, and we added soybeans. about a half of a cup of soybeans every day, which you cook in a pressure cooker. And what we found is that the moderate to severe hot flashes were cut by 84%.
Wow.
And also we also looked at sexual changes, vaginal dryness and that kind of thing. And those things can improve to a degree too. Now, I think we need more research, but we did that study. That study was published last fall, and we have repeated the study. We've got more evidence now. So I would encourage any woman who is sitting down with her doctor, and the doctor is saying, I'm going to write you a hormone prescription, but you can only take it for a little while because these hormones cause breast cancer, and they might cause a heart attack, and they cause blood clots, and they might increase your risk of dementia. And the woman is going to say, stop. What's my other choice? And the other choice is healthy plant-based diet, add the soybeans. The beauty of that choice is it doesn't just tackle the hot flashes. It tackles all the other things that you're worried about now. You're worried about it's really hard to lose weight right now. Well, this makes it easier. You're worried about how the health of your heart or the risk of getting breast cancer. Well, if you're on a plant-based diet that has soybeans in it, women consuming the most soy products have about 30% reduction in their risk of breast cancer. Don't take my word for it. Try it out yourself. Our study was 12 weeks. For some women, the relief comes instantly, within a matter of a couple of days. But for others, it takes longer. Give it some time, and you'll see.
Brilliant. You mentioned sleep being disrupted. Now, independently from hot flashes, I've noticed for myself, for example, I sleep a little bit less. I'm 40, and my sleep is really light in comparison to before. And I always wake up in the middle of the night. I mean, I now have a routine where my husband cannot put the lights on. He cannot have the phone into the room. And in the middle of the night, if I have to go to the loo, I have to have the map of my way to the toilet without crashing into the shower because I don't want to put the light on. So otherwise I cannot go back to sleep. And I'm like, okay, what's going on? I never had trouble sleeping. Things are changing. Something is changing. What do you think? Well, I'm going to ask about me then. What do you think I should do? Why?
Well, Chantal, the problem that you have is you have so many great ideas and so many things that your brain is coming up with. And so when your day is done and you've had some sleep to sort out all the problems you had before, your brain is giving you all kinds of new, wonderful things to think about. And so they're coming to you about 3 a.m, and that's what's waking you up. Okay, I'm only half kidding. Let me talk about just maybe these issues in general. Not just you, but these are common. And there are a couple of things that just should be said right away for anybody. Caffeine and alcohol are very common in our culture. I'm not talking about you, but I'm talking about your listeners and people in general. You have a little bit of tea or some coffee or a soda. Some people eliminate that caffeine quickly. For others, it lingers on. And so you had some organic breakfast tea, and many hours later, you're trying to go to sleep, and some of that caffeine is still there. It makes your sleep light. That can happen. A glass of wine can do the same. Wine lures us into sleep, but the alcohol molecules are transformed in the liver to aldehydes about 2 or 3 in the morning, or 4 o'clock in the morning, and that wakes you up. So those are 2 things that are important. The third thing is it's a really good idea to figure out your exercise pattern. And for everybody, it's different people, it's different. There are a lot of experts who say don't exercise just before bed. I completely disagree with that. I think that if your muscles are not a little tired, your body says, why are we resting now? I don't really feel like sleeping. So a person does some push-ups or some squats or something like that, and their muscles get kind of tired, and they find that they sleep more soundly. If I run 5 kilometers in the morning, nighttime is much later. My muscles aren't really tired anymore. So getting some kind of exercise, it makes the sleep a little bit deeper. The last thing I'm going to say is that if a person has a lot of protein in their diet, whether it's meat protein or hopefully it's not, but even something like tofu or tempeh or beans, which are very high in protein, that can sometimes stop us from sleeping well also, because protein blocks the formation of serotonin in the brain, which is a sleep chemical. So at night, it's good if our meals are light, more starchy grains, lighter kinds of foods, and that will often help us sleep a little bit. And if you wake up and you get up and you have a little bit of bread or something like that, you'll often find that it helps you go back to sleep.
Oh, wow. That's amazing. Bread.
Can you believe it?
No. Brilliant.
But you just got to make it without turning the light on, right?
Yeah, of course. I have to have the map to the kitchen now.
Yeah, good luck.
What about a lot of women that struggle to sleep? But you're right, it is a problem a lot of people have. Take melatonin, which in some countries allowed, other countries not allowed. But they do take it. But then the concern can be melatonin can tend to raise blood sugar for some reason. And is there I don't know, something like could instead of melatonin, could somebody take maybe L-tryptophan to help sleep, or do you think just the hormones that we make by having some nice carbs at dinner time should be enough in a stretch?
Yeah, my best guess is that these compounds are probably safe. However, I guess I do raise the question of why do we need them? I'll tell you one other just little trick that I've sometimes used, and this will sound kind of crazy. You look at a child, and a child does not, let's say it's 10 o'clock. When the child's going to bed, the child doesn't take the book that he's reading and slam it closed and turn off the light and try to sleep. What they do instead is, starting an hour or so before sleep, they start to yawn, and they stretch, and they yawn, and they're going through a pre-sleep ritual. If you have a dog or a cat, they do the same. When I was in medical school, I had a rescued laboratory rat. She had been in the laboratory, I rescued her, and she would do the same thing. Before she would go to sleep, she would stretch out her little rat paw and yawn and go to sleep. But when we're adults, we don't do that. We say, this has been a very nice documentary I've been watching. We turn off the TV and we try to sleep. Try this, and it'll sound crazy. You don't have to tell anybody you're doing it. Try this. A half hour before you go to sleep, start to yawn. You won't want to, but do it anyway. Open your mouth and just make a big yawn and hold it, and it will become a real yawn. Do it 4 times, and when you do it, stretch like you are a 4-year-old child doing this. Your brain says, oh, Chantal's going to sleep. Well, let me turn out all the lights, let me pull the curtains, let me get ready, and it starts to get you ready for sleep, and you will discover that you sleep better. Just before that, if you did some push-ups and got your muscles tired, then you are like a little kid who is running around getting tired, doing their ritual, and they sleep better. Give it a try, see if it works.
It makes sense. I will try the yawning and tonight, and I'll send you a message tomorrow. But I also, I think it makes a lot of sense. In the yoga nidra, which is a practice to go to sleep, there is a lot of that. A lot of deep stretches and kind of breath that is like yawning, bringing that more oxygen in and really just relaxing. And I think, the whole thing about yawning is really fascinating, because a lot of people don't even really cannot really explain where yawning comes from. But I think it's really that muscle, kind of the body's way to use muscle to get us into a place of being relaxed. It's not that we're bored. It's just like, okay, too much. Let's just stretch it out through our mouth.
Who knows? We don't know what this is all about. But if you want a little fun experience, I have a musical group that you may not know about called Carbon Works. And I work with musicians all around the world. And in the beginning of the pandemic, when everyone was so stressed, Carbon Works released a video on YouTube called Everything's All Right. And we did it in French, which is even better, called Tout ira bien. Things will go fine. Everything will be fine tonight. So go on YouTube, look on the Carbon Works channel, and there's a song called Tout ira bien. And all it is, it's a cat yawning, a puppy dog yawning, a frog is yawning, birds are yawning. And you can show this to a little child, and there is nothing mean in this little lullaby song, and you're going to sleep like a baby.
Oh my gosh, I'm doing this tonight. This is brilliant. We should put that on our resources for a Monsanto at some point.
Please do, yes.
Well, Dr. Barnard, having you on is a pleasure, and thank you so much. Your book is fantastic. I will put all the details and the links in the show notes, because I think people will really benefit from buying it, women and men. And I love your little stories and anecdotes about men fertility as well, because obviously I don't really see a lot of men clients or at all, but I hear about men struggling as well. So this is really a good book to have, and it really helps also men or husbands understand their wives, which is great, because sometimes they're like, "You're crazy, your hormones all over the place." Well, this is why. And yeah, it's such a great resource, and I mean, all your books are. I really love them, and the work that you do at PCRM for all of us is amazing. So thank you so much, and thank you for being on. I really am honored.
Well, thank you, Chantal. Thanks for all that you do to educate and to inspire people. It's a pleasure to have been with you today.
Thank you. See you very soon.
Thank you. Thank you.
Bye.
Thank you so much, everybody, for staying on for the podcast today, and thank you, Dr. Barnard, for being our guest. Such a pleasure to speak to you and listen to all the findings of your studies. Guys, if you have loved this episode as much as I do, please follow, please share, and rate so that we can get higher on the rankings and we can be sharing this knowledge with more and more people. I will see you next week. Bye, everyone.